as the number of COVID-19 hospital admissions rise, there is also another worrying trend. Children aged 5 and under are also said to be among hospitalized patients. The group is not yet eligible for vaccinations. Currently, vaccines are only available for people aged 12 and above. For more on this, I am joined by Professor Sithembiso Velaphi. He's the head of Paediatrics from the Hani Baragwanath Hospital in Soweto. Prof, thank you very much for your time. Let's start with the pediatric admissions. Is this happening particularly at Hani Baragwanath?
Good morning, Maseko and the viewers. Yes, we do see children with COVID-19 infections, but it's not an increase in terms of the infections in that age group. The number of patients that we're admitting are the same as before the pandemic. So on average, we admit about 18 to 20 children per day. And that number is the same as what we used to have before 2020. Sure, with the lockdowns and the high alert levels being implemented in the country, we did see a reduction in admissions. So the admissions that we are seeing now is the same as before the pandemic. But because as part of the plans in terms of managing the wards in our hospital, every child who gets admitted gets a test for SARS-CoV-2. And yes, we are picking up those children. So there are more children than before who are positive, but it's not that there's increased admission. And again, we need to look at the overall context that the children that get admitted are admitted with different conditions, which we normally see. Also, what we think is more incidental finding that they are positive, and I think it reflects what's happening in the community rather than being sick coming in as SARS-CoV-2 as a cause. I think there might be some, but I think there are very few who might actually sick because of that. But we think it's more incidental finding rather than the cause of the patient being admitted.
Well, of course, I was asking the question in terms of COVID-19 patients under the age of 5, pediatrics being admitted at Bara Hospital recently since the announcement of this Omicron with which is more transmissible. My question was obviously about the fact that are you seeing an increase in the number of children who are hospitalized at Bara due to COVID?
No.
Okay.
The number of patients that are admitted at Bara is the same as before. We are seeing more positive patients than before. That is correct. Okay. So I think we need to interpret the statement correctly to say the number of admissions are the same, but because we're testing each and every child, we're seeing more positive patients than before. Now, normally, generally, children who get admitted are in the group under the age of 5. 75 to 80% of our admissions at Baragwanath, even before COVID, are under the age of 5. So when you are testing everyone, and the community has got an infection that is spreading widely, you are going to pick up that in children also. So generally, we're picking up 3 to 4 patients who are positive with SARS-CoV-2 in our admissions. So which is about 15 to 20% of our admissions are positive. But overall, the admission is the same as before.
Are you aware of how Hani Baragwanath Hospital is doing in terms of admissions related to COVID-19, not just general admissions, admissions related to COVID-19 overall? Is it increasing since we're seeing these numbers that are rising, particularly here in this province?
Yeah, again, as I say, that related to COVID-19, we don't think that number is increasing as a cause of the admission. Okay. So, for example, the babies that we're seeing the gastroenteritis as before, we're seeing the bronchiolitis, we're seeing the laryngitis.
No, Prof, I'm asking you
with diabetes.
I'm asking you if you are able at all to tell me, by looking at the hospital, are you seeing more admissions generally?
No. So we're
generally,
not
just children.
generally.
Okay. All right. Are you concerned at all? Because the health minister, as well as the premier, they've had quite a few media briefings speaking to the people in the province and in the country, talking about a concern of a trend where more younger children are being admitted. Bara is a hospital that is the biggest in the continent. It serves quite a number of communities, not just Soweto. So is there any concern, maybe some meetings from management in terms of trying to mitigate if there is anything that, will show you that you'll run out of bed space?
Yeah, so yes, there is a concern in terms of the space, because since we're grouping our babies to those who are our children, to those who are positive and those who are negative. So for example, if we're saying 15 to 20% of our admissions are SARS-CoV-2 positive, that group of babies must go to their separate wards. So that ward, which we call Ward 39, is normally it's got a capacity of going up to 15 patients, but we're running at about 12, 13 on average. So we were sitting at about 75 to 80% of that ward being occupied, compared to before we're running at 50% or less in terms of the patients with SARS-CoV-2.
And Prof, is there any word from you as you sit in these meetings as management in terms of, what you'd like to see maybe during the December season? I mean, we all remember that photo that the Hani Baragwanath Hospital shared last December when the country was under harsher restrictions in terms of accidents that happened and some other violent activities that happened during this festive season. Are you hoping to see a repetition of that this time around so that you can cope?
Yeah, so our request to management, because if we continue admitting 3 or 4 babies who are SARS-CoV-2 positive, so one, we're going to need more space. Now, number 2, we're going to need more nurses to look after these babies because they are in their own ward. And number 3, we're going to need more doctors to look after them. Now, luckily, so far, of the babies that we have currently in the wards, as I speak this morning, so we've got about 12. 3 of them are on oxygen, and the other 9 are in room air, are not requiring oxygen. So in terms of the severity, so far in this age group, we have not had bad cases, severe cases. Okay. So I think if as time goes on, there's more demand, then yes, there's going to be more pressure to the hospital.
So let me just clear this up before I let you go, Prof. For the moment, because of the fact that the children who are admitted are not a larger number than before, but also the fact that there are children under the age of 5 who are being admitted, it obviously has to do with some other comorbidities that they might have. There's no reason for us to be concerned? Is that what you're saying?
Yes, there's a reason for.
Okay.
No, there's a reason for us to be concerned. Because of our normal admissions that we normally see in terms of the numbers, more of them are SARS-CoV-2 positive.
Okay.
And being SARS-CoV-2 positive, if you are testing every child and in the community where they come from, there's a high incidence of the infection, you are going to pick up more babies with the infection. So that we're having more of our admissions are related, have gotten the positive results, is of concern because we need space for them. So there is definitely a major concern for us because we need more space. We need separate doctors to look after them, nurses to look after them, the necessary equipment that we require to look after them. So the other major part is also in children, newborn babies. We are seeing a lot of mothers who are positive. And those babies, then some of them are born prematurely, and some of them have got some respiratory problems, in which case they need to be admitted to a ward. Normally, we don't admit if the baby is well. They stay with the mother, even if the mother is positive. But now the risk is that some of them were born preterm, and some of them have got some respiratory illnesses, which might not be related to the SARS-CoV-2, but it might just be part of the prematurity, part of the newborn baby. Those babies, in terms of space, were overwhelmed. Because, for example, in one day, we had 20 mothers who were coming in to deliver, being positive. Now, of those 20 mothers, if you have about 15% of them delivering preterm, So all of a sudden, you have to have a space for those babies. And the space limits, we've got about 4 or 5 beds for those babies. We have been overwhelmed in that area when it comes to new needs. So the bedding is not only in the children, it's also in pregnant mothers whose children might have other problems related to the newborn conditions. We need their space in terms of separation. So yeah, there's a demand for space and for human resources in all the areas in terms of the maternal and the bigger children under pediatrics.
Prof, I'm running out of time, and I'm sure Veronica is going to shout at me because she keeps telling me to wrap up very quickly, but I think this question is very important. In terms of the children that you are admitting who have COVID-19, how severe is the situation there? Do some of them die? Especially because, you know, we're still waiting for vaccine administration to at least reach those ages. So how bad is the situation every time they're admitted?
Yeah, so since we've seen the increase last week, we have not had a single death that is related to COVID-19 from our assessment.